I can hear you. Brianna, I can hear you. I can't see anything.
Is 4 p.m. So welcome to those who are watching. First thing I'm going to ask everybody, please mute your cell phones so we don't have any interruptions. I know that can happen quite frequently, and we all live in that technical age. I will now go ahead and call the meeting to order. Let me tap my gavel once. The first thing on my agenda is to go ahead and if everybody would please give a moment of silence. This will be for Mr. Ken Waller, our first county executive for Jefferson County under the Charter Form of Government. So, a moment of silence, please. Thank you very much, and all my condolences go out to his family across the board. I know it is a very tough time for all of them at this point in time. Next on the agenda is something new. We have a new building, a new way. We're going to do some new things. This was kind of asked for me by one of our constituents, and I had noodled it and talked with a couple of you folks, and I think we all agreed. So if we'd all rise for the Pledge of Allegiance, please. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For those who are wondering, just real quick of kind of the considerations, with all the things that are going on right now in this country, I think this is a good thing that we need to put back in every place we do and everything we do. So if others don't like it, well, I'm sorry. They can run here, sit in this chair, and they can change it. All right, next on is the roll call. Ms. Pinkley, would you please do roll call?
Mr. Pig?
I am here.
Dr. Henry?
Here.
Ms. Stidham?
Here.
Mr. Deal?
Here.
Ms. Taylor?
Here.
Quorum has been established. Ms. Henry, would you please read our mission, vision, and purpose?
Sure. Mission is to promote positive health outcomes through delivery of foundational public health services. The vision, a healthy Jefferson County. And the purpose of the health center, the JCHD is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you. Now we have approval of the agenda. If I can have a motion and a second, please.
Make a motion to approve the agenda.
We have a motion to approve the agenda. Do I have a second?
Second.
We have a first and a second. Any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. I know we have one guest in the audience, Mr. Liederbrand. The leader is here as well, so we appreciate that. Next on the agenda will be approval of the July 24th, 2025 meeting minutes. Motion, please.
I'll make a motion to approve the minutes.
from July 2024.
I'll second.
We have a first and a second. Valerie seconded. Is there any discussion on the motion? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is approval of the July 25 expenditures, and this is for $77,098.75.
I make a motion to approve.
I'll second.
Go ahead.
We have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is the approval of the July 2025 electronic payments for $523,142.23. Do I have a motion, please?
I make
So
a
moved.
motion that, I'm sorry. I make a motion that we approve the July electronic payments, 2025.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is pre-approval of the September 2025 electronic payments for $650,571 and no pennies. Do I have a motion?
I make a motion that we approve the September 2025 electronic payments.
I'll second.
We have a first and second. Is there any discussion on the matter? Not,
Please.
yes, I'm sorry, go ahead.
I know two meetings ago, I'd asked about this wind stream, and I see that the estimated amount is higher than the actual amount from the month before, and we had budgeted 15. I know we already approved this, and that was 16. Now we're up to 17. Have we looked into bidding that out or trying to see if we can get that cost down?
We have not.
Microphone,
Yeah.
microphone.
I got onto you all. No, we have not went out to bid on that. We're in the building now, but that is on Mr. Steve Ferry's agenda to do that. I think we have our process laid out
Great,
for going out for bid, and that's in the works to do,
great.
yeah.
Thank you. That's all.
Do you have a comment? I could add to that. Do you want him to? It's up to you.
Okay.
I did also just want to touch on that. When we moved,
Nope.
just checking.
Get it closer.
When we moved from here to the old building, we reduced some costs with Windstream that probably hasn't been reflective yet because we
Okay.
just canceled. So we should see a decrease in our bill
Great.
coming up, so.
Thank you.
No problem.
All right, thank you for all that.
Yes, thank
We
you.
still have, is there anything else?
No,
Okay, sorry, want to make sure. So we have a motion, a first and a second, discussions over at this time, and that's for $650,571 and no cents, pre-approval of the September 2025 electronic payments. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Mr. Sykes, Director's report, please.
Okay. The first item I'd like to talk about is, I think at the last meeting, if you recall, I mentioned that we are reviewing the cost reimbursement charges for the environmental food program, and they have done that review. Actually, the review's been going on for quite a while, but they've come up with the fee schedule. That was included in your packet, but I did want you all to have a chance to review that. And I asked Dan, the environmental supervisor, if he'd come in and speak on those, how they developed the new rates.
So I'm just going to give you a brief overview of the process that we went through for this update on the fee changes. So in 2018, that was the last time that our fee schedule was updated. There were no significant fee changes in 2018 to that fee schedule. The last significant changes to prices of permits was done in 2014. The previous environmental supervisor was set to adjust the reimbursement costs in 2022, but due to COVID and financial struggles that local businesses were under at that time, it was decided to hold off on adjusting any fees. Towards the end of 2024, my staff and I began looking into the need for the cost reimbursement charges to be increased. We surveyed the types of permits and charges for all counties in Missouri with a population greater than 100,000. This included 12 different counties in the state of Missouri. The Jefferson County Health Department had the lowest charges for the 6 counties that had a population over 200,000, just when we were gathering that info. One key team member of mine also put together a study showing the true program cost for each permit. The true program cost was calculated utilizing a capacity building formula provided by the National Environmental Health Association. So in your packet, the proposed cost reimbursement charges for 2026 that was presented to, this is the presentation that we gave to administration. You'll see that the true program cost is considerably higher than the proposed new permit charges. So it was kind of a balance of not making too many changes all at once that would affect the facility owners. So just a quick summary of the changes to the permit charges. Low priority annual permits for both food establishments and mobile food establishments will increase by $25. Medium priority facilities, both food establishments and mobile food establishments, will increase by $50. And high priority facilities for both food establishments and mobile food establishments will increase by $75. Any other fees that were increased that were not part of that true program cost will receive, any fees that were $99 and below will receive a $5 increase, and any fees that were above $100 will receive a $10 increase on those, and that's just to cover the cost of transactions. Any questions for me?
What are the current fees? So what percentage increase are these?
I think for the most part, it's right around 20% increase. That would be just for the annual permits, not for any of them that are just covering the transaction costs.
And when would this take effect?
2026.
Okay. Sorry.
Part of the reason why we needed to get this proposal before administration, we start our renewal process for permits in November 1st every year. So we wanted to have time to communicate that to the facility owners.
Right.
So they don't go into effect until next year, right?
Right, yep, January 1st. They typically will renew their permit anytime between November 1st and December 31st.
So, I mean, unless there's any objections that you all see, that's what what we're gonna go ahead and put into effect for 2026. I think it's nominal, we haven't had a across-the-board increase for quite a while, and we all know how inflation and everything has gone up. I don't feel that this is too big of a burden for our establishments in the community. So I think they did a very good job of calculating the true cost and looking around at different counties to see where we are with our fees. So I think this is a pretty good estimate, or a fair estimate of what we're gonna charge. All right, thank you, Dan.
Do we need to vote on that?
No,
It's in-
I wanted the board to know, we may receive some calls when costs go up, so I thought it'd be good for you all to know about it. My next point, I did confirm with our medical director, he will be at our September board meeting. So I would like to have your topics or questions that you have I believe last board meeting, I asked to have those by this board meeting so that we can get them to him, and he can have something prepared for our next board meeting. A few other things. Jetty and I attended a administrators training in Jefferson City on July 30th and 31st with the Missouri Department of Health and Senior Services sponsored this. Actually, the director, if I can get it out, spoke at this meeting. I would say probably the majority of the administrators across Missouri were in attendance at this. It was a pretty good training. They had a mental health first aid course that we went through. The state is trying, the health department is trying to train over 500 people in this mental health awareness that is focused more on adults and how you can be aware of someone that may be in mental health crisis and what you can do, fellow employees or just someone you come up on, what kind of service or how you can direct them to get the help that they need. I think we attended till 7 o'clock one night and up next morning going, but it was a really good, I learned a lot from that training. I also want to point out, back to our environmental program, they received word, I may have mentioned this, but back in June, they received confirmation from FDA that they are in conformance with 6 out of the 9 retail food program standards. This is the national voluntary retail food standards that the FDA has. We've been a part of this for several years, and they are in compliance with 6 of 9, which is a really good number. There's very few agencies that have 9 out of 9, and there's, I don't know, is there any in Missouri? I think maybe Clay County, 2 that are complied with all 9 of them, but they continue to work on those standards. This really helps with our program uniformity among our inspectors, that they are, they all go through the same type of training, field training, online training. We look reviewing their inspections. It's a good way of analyzing your program and setting standards for what you want to achieve with your program. So I just want to give them a notice at the board meeting. As I mentioned last time, Steve is still working, Mr. Crawford, on the furniture at our old location. We're going to put those on Gov Deals. What sells will go. What doesn't sell, more likely will stay with the building. I don't know if we're going to, there's some desks there that we don't want to move out of the basement. So hopefully we'll have some people go on Gov Deals and look at that. Once that is done, then I think we'll look at what we need to do with the building itself. My final discussion point is I would like, we've invited Mr. Scott Darrow with our Vector program to come and speak about the mosquito program that he's been, how many years now have you had the program? 8 years. So just come and give us an update of where he's at with the program this year.
Step up to the microphone, please.
Well, good afternoon, Board. Is this our first meeting here? Board
Second.
meeting?
Second meeting.
Oh, okay, I was hoping to maybe get in on the first one.
It's okay, you're good.
Okay, so I was asked to do a briefing on the Vector program, an update. Our adulticide treatments of unincorporated areas began on May the 21st. To date, all 3 contracted municipalities have received their monthly treatments. These municipalities include DeSoto, Hillsborough, and Kimmswick. Daily treatments are conducted in the evening, usually over 4 hours. Typically, starting time will range from 7 p.m. to 8 p.m. through 11 p.m. to 12 a.m., depending on the season's changing daylight hours. Treatment requests by county citizens are typically addressed within 48 hours. To date, 81 county citizen Treatment requests have been made. Non-treatment requests are always honored. Scheduled events within the county have received pre-treatment as a preventative measure. This would be like the county fairgrounds, fireworks displays, that sort of thing. Unincorporated areas throughout the county have received targeted preventative treatments. These are regional areas of the county that have been assigned titles for treatment reference. This is what we do. I'll set up an assignment, let's say, to do what we refer to as LA, that's Lower Arnold. Plas Pass, that's the Plas Pass Road and surrounding communities, that sort of thing. When a sampling site is deemed positive by means of testing, an immediate treatment response will be enacted. Determination as to where treatment should be employed is based on the following. 1, confirmation of West Nile virus. Municipal treatment. 2, municipal treatment per agreement. 3, request for treatment by county citizens. And 4, preventative treatments. Treatments are expected to conclude on September the 30th. This could change depending on environmental conditions at the time. That has happened in the past. Surveillance is based on mosquito testing throughout the county, utilizing 60 trap sites. Surveillance within the county began on June 12th. To date, surveillance has not proved or has not provided any positive sites for West Nile virus. To date, Jefferson County has no confirmed cases of West Nile virus, confirmed human cases of West Nile virus per the Missouri Department of Health and Senior Services. Surveillance is expected to conclude September 30th. This could change again depending on conditions at that time. Last year I ran into October and I did come up with some positive samples, like the first week of October. Any questions?
Okay,
Yes.
thank you. Oh, I'm sorry, go ahead.
You said there was no West Nile virus, no Zika or anything else
No, we
to
don't test for
report?
Zika. We don't test for chikungunya or dengue or anything
Okay,
like that.
gotcha.
It's just West Nile virus.
Thank you.
Those typically show up later in the season, too.
It builds. It builds. It's just like the flu season. It builds as it goes, yes.
Okay.
I've got some that need to be counted and tested out. I don't know if I'm going to get it today or not. I'm hoping to tomorrow, but pretty soon I ought to have some tripping the switch here.
Thank you very much.
All right.
Thank you.
Thank you, Scott. That's into my report.
All right. Does anybody have any questions on the actual other information with inside the packet? I know I have one. Go ahead.
Could I just say thanks to the leader for publishing our food establishment inspection reports. I think it's a great public service. And I was just wondering if you guys get any questions or comments, do you have a way to pass those along to us? If I do, I'll pass them on. Okay, thank you.
I do have one question, Stephen. I'm not for sure who to direct it to, but it is the animal bite investigations. I see there's been 33 in July. That seems a little high to me. And I don't know, maybe it's not. Are these domesticated bites or these?
Do you want to speak on Gina, or you want, Scott does a lot of the investigations, and he just left, so.
And he just ran, just a quick of, are these like dog bites in the neighborhood, or because, I mean, I had a rogue skunk the other day, and he's out in the middle of the day. Skunks are not out in the middle of the day.
Don't pet the wild animals.
Well, no, but they're not supposed to be out in the middle of the day, you know what I'm saying? I know what's going on then, so that's what I'm trying to warn everybody. If you see an animal that's acting strange, especially nocturnal animal, that's out in the middle of the day, there's something wrong.
Yeah, don't pet the wild
Well,
animals.
no, don't pet the wild animals.
Yeah.
I got that the first time.
We've been looking at the numbers, and we do see quite an increase in the summertime. Everybody's out and about, running around, they're at barbecues, they're visiting family, and that's a lot of what we see.
It's more domestic dogs, okay.
Yep.
That makes a little difference, thank you.
Yep.
That's all I had. Anybody else have any other questions? I'm sorry, I didn't mean to turn it upside down. Where am I at here? Oh. Public comments. Any public comments? Not hearing any? Going once, twice? Okay. Moving on to old business. Steve, you get to talk again about the new building we now have.
Yeah,
We're not
so,
quite finished with it, I know.
yeah, we're still working on a few of the punch list items. They're coming tomorrow to fix a few things. Even everybody knows how new construction, you always see a few things here and there. We are still working on that. But we do see the light at the end of the tunnel. The building's working well for us. We're still trying to find our way around, but it's been a great experience, I tell you. I think this will probably be my last report as far as a new building report. I think most of the stuff that I can talk about, I'll just do in my director's report, if that's all right. There's not a whole lot about the building I need to talk about. I do have the financial for the architect and the construction payments. We'll continue to put those in until we're all settled out. Really, what I'd like to talk about today is have Brianne come up and speak a little bit real quick on our dedication open house ceremony that we're going to have on September 17th to get that out there for the community. So Brianne, Brianne's been a big part of this. Her and I, Jetty and Mr. Pig have worked together on this, so I'll let her explain it all.
I've been just listening.
Okay, so our open house and ribbon cutting ceremony is set for September 17th. That's a Wednesday. It will start with our ribbon cutting ceremony at noon, and then I'm estimating between 30 to 40 minutes for the dedication ceremony. I know, I believe Mr. Pig is going to say a few words. I know Mr. Sykes is. I believe maybe other board members have the opportunity to. We'll go through that. The Chamber of Commerce will be there. We'll do the really cool ribbon cutting where we get the really big scissors, and we'll do our group photo. And then once we finish that, the facility will be open. We plan to have that from, I said 1 to 5, but honestly, whenever the dedication part is over. And it will be, it's not really a self-guided tour. It's going to have, we're going to have pretty much a route that folks can come through the building. We'll give them their map, they can follow, and we'll have employees stationed throughout the building to kind of help guide people through, answer questions, point out some of the really cool stuff, make sure they understand, you know, all the nifty things that are in the clinical area and all the different pieces. And folks they'll be able to see the clinical side, our office side, or community services, and then they'll kind of end here in the conference room where we'll have a lot of our program tables up so that folks can talk to anyone who's coming in about the different programs and services we provide. We'll have some marketing materials and education pieces. We're gonna have some fun swag, so folks can take that with them. We'll have light refreshments, and then, you know, mingle. And I believe, like I said, that'll be from 1 to 5. It's open to the public, to partners, to the media. I know that the leader is attending. I believe KJF, the local radio station, will be attending as well. I've put out a few feelers to some of the St. Louis market reporter friends. I haven't heard back, but we shall see. And I know that we have a couple of elected officials that have RSVP'd, even though you don't have to RSVP, they kind of let us know. So I know we have a few elected officials that are coming, and I believe the director of Department of Health and Senior Services, the Missouri, is going to try to come. So, is there something else you'd like me to cover?
And did you mention we'll have our vans set up as well
I did not.
outside so that they can, the van that just backed in a second ago, it and our other, the youth dental will
Yes.
be over on that side of the building. They can
Yes.
tour those as well
Yeah.
as part of the.
So we'll have the mobile health unit and then the dental van kind of right out there, so folks can either hit that on the way in or maybe like on their way out. We're gonna make sure that there's folks outside of each of those as well that can provide some of that program information.
So are we going to have any location open?
Yes.
Is Arnold gonna be open for, in case
Yeah, clinic,
they need something?
and I'll
I'm just
say,
asking.
yeah, clinic
Make sure everybody knows.
services will happen in Arnold. And you guys tell me if I get this wrong, because apparently sometimes I get things wrong. We will be here, they can still do walk-ins for vital records, correct? Isn't that what we decided? And we'll still do vital records, but will not have clinic. That way we can have people go and walk through
Full
the clinic.
access.
Yeah.
Okay.
But we are having clinic services in the Arnold office.
So give the date and time again, when all this is gonna happen, one more time with the date and time and,
So it's Wednesday, September 17th, so
Right.
just shy of 3 weeks.
right?
The ribbon cutting starts at noon, and then open house immediately to follow up till 5 PM.
All right. Thank you. Is there any questions by any of the board?
Really like to have the board in attendance. Hopefully, the director will be able to make it. I think it'd be great for her to come down and meet you all as well. That doesn't happen very often. They're extremely busy, so I'll be hopeful if they make it. Thank you, Brian.
Yes, thank you very much.
And that's all I have for my new building report.
New building, all right, very good. So now I'm gonna need a motion, this is new business. I'd like a motion a second before we have discussion. This is, will be needed a vote. This is approval of the sale of the adult dental van. Do I have
I'll make a motion.
there's a motion to approve. Do I have a second?
Second.
I have first and second. Discussion, Mr. Sykes, we'll start with you, then let the board answer the questions, or ask the questions, sorry.
Well, I think we've mentioned this already, that we were planning on selling it. We do have some values. We did some checking on the value of it. We have a set amount. We're going to go through Gov Deals with that as well. We can put a reserve. So the plan is to put the reserve on Gov Deals. The other thing with Gov Deals is that you can evaluate if your highest bid does not reach reserve. We can make a decision on whether or not we want to go ahead and accept the next highest bid. So we've got a pricing there. I really don't want to throw out prices.
We're not supposed to.
Yeah, so, I mean, we could,
It's a competitive
yeah, it's competitive,
bid.
but I can, if in closed session, if we need to discuss that, I can, if you're wanting to know the values of it that we have. But that's the process. If it does not sell, then we will need to look probably at the company where we bought it and see if they can sell it for us. But that's a consignment where they'll keep some of the money, profit of that as well. So hopefully we can just sell it through Gov Deals. We had another county that was interested. I don't know if they still are, but we'll reach out to them to let them know that. But the easiest thing to do is just to let them know it is for sale. They can come and look at it, but they need to go to Gov Deals and to bid on it. So.
Remind me again, why are we selling it? Is it because of age or
Well, we're not able to support both
vans?
both programs.
Okay.
We are seeing youth on the youth van at the schools, and to do both programs, you really need to have almost two sets of, two crews, I guess you could call it, to do that. And we have not had very good luck of getting that program back up. As far as the adult program, emergency issues, we will still look at. And we're not totally saying we're never gonna do this. We're gonna evaluate, but the van itself is, we can't sustain the program and have that van sitting in our parking lot. It's depreciating every month, insurance, everything else, so it just made sense.
Is that another COVID victim?
Yeah, that was a
Killed that
lot of it.
program?
Yeah, the nursing homes, I believe, was one of the major issues. We couldn't go into the nursing homes, and it just never recovered from that. So,
Any other questions? I'm gonna ask this carte blanche. Does anybody want to actually know the price before they vote, or are they okay with moving forward? If we want to wait till after the closed session to bring this back up, it's all right, not hearing any, so we have a first and second on the floor. So I'm gonna look for an approval for the sale of the adult dental van. Put that in Steve's hand, put it down on Gov Deals. So all in, now let's do roll call. Roll call, please. Making her talk.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
Okay, motion passes. Thank you very much. The next discussion point, and I don't know if Christie's online to be able to talk about this. I'm sorry.
Did you skip
I am.
comments? Do we have one?
Yeah,
Did I
he
skip
did.
what now?
He did public comments.
Public comment?
I'm here.
No, I did public comments.
Okay.
There was nobody, I asked for a first and second, nobody, yes, I did. So next on there is proposed industrial, thank you, Christie, for letting me know you're there. Proposed industrial development projects, I don't know if everybody had an opportunity to review. I guess they're two TIF, I don't know if they're actually TIFs or not. Christie, do you want to speak to that a little bit for us, please?
Sure. So we got an impact statement for two projects that are in development. One is with the city of Arnold and one is with the city of Festus. The Arnold project is for an industrial facility and the Festus project is for a hotel. Because we are a taxing body that would theoretically receive taxes from the revenue generated by these facilities, we potentially have impact if their respective cities provide any type of tax abatement as an incentive for these developers to come in and build the facilities. So according to the abatement forecast that they've given us, if their respective councils adopt the TIF, the abatement plan, then we would lose out on approximately $19,000 on the Arnold project and $30,500 on the Festus project. They have given us the opportunity to either submit a written input or to go to the council meetings themselves so that we can provide any type of feedback that we would have on any type of objections that we would have to the abatement, so that we don't lose out on tax revenue. We are already at the maximum tax rate. So the board needs to kind of give Steve some direction as to whether or not you want him to either attend the council meetings, to write an opposition statement or input statement, or to say, hooray for these communities, let's welcome these facilities into the community.
So what are our options to ask to opt out of the TIF?
No, we can't opt out. So if the councils do approve the abatement plans for the facilities, for the projects, then we are impacted. And we don't have the ability to say, no, we want to opt out of that and everybody else has to bear the brunt of it. Either the council adopts it as a whole, they can also tweak the abatement plan so that it's less of an impact, or they can vote it down.
And Christie, is the amount that we would lose, is that over the life of that, over so many
Yes.
years? So it's not like
Yes.
impact is just 1 year, it's just,
It's 10 years.
yeah, that we
Yeah,
would
so
lose.
it's over the life of the abatement.
The city of Arnold was a 10-year. Yeah, city of Arnold's 10-year. And they actually have it, it's not a full tax abatement on theirs either. So they've kind of got some money coming, but. So just my perspective on it, I've always been kind of 50-50, especially in areas that I would consider not a blighted area or an area that's really hurting for business. It's not like we're trying to start, of course, the Arnold one may be, because I'm not sure exactly where that's going. But generally, I don't think Arnold's hurting for business right now. I don't think neither is Festus, but I also understand.
It's
the
off of
ability-
Tenbrook, Tim.
Yeah, I'm also understanding, the need for it, because, it can help growth. And I know the one in Arnold, there's not, the actual value of the property, I think, was assessed at like 28,000. It wasn't very much, compared to, I think, the valuation they were thinking was gonna be over 2 million. So you look at the 10 years of not getting the small amount, and then after that, you're gonna be bringing in more money. So I'm really kind of 50-50 on it for the most part. I understand why. I don't think we're gonna have an impact either way on either one of these cities, whether we say yes or no. Most likely, by the time you get to this point, the cities are pretty much gonna go with it. So that's just my particular stand on it. So, anybody else have a thought and a concern, please speak up.
I agree with what you said.
Yeah. And I pretty much assume if we don't say anything and don't do anything, it just goes away, or goes on, correct, Christie?
Correct.
Yeah. we
I
don't
mean,
have-
unless, like, we're actually one of the smaller taxing districts
Right.
that would receive revenue, like the school districts, for example, they receive a pretty hefty chunk. They have a larger impact than us, so, they may have a little more weight in objecting to such a plan because they have a larger stake in whether or not the abatement plan is approved.
Yeah, like you look at it again, they're just not bringing that much tax money in right now. So that's why I kind of look at it. So, all right. Does anybody have an objection just to let it go forward without a yay or nay or nothing, anything? Don't approve, don't deny, just don't even send a letter.
Yep, I'm fine with
All
that.
right. All right, we're
Is there
gonna,
any
I'm sorry.
point in having someone attend the meetings or not?
Steve, I don't know if it'd be worth it. I don't know. I guess you go there to listen, have somebody go there to listen, just take notes on it if you wanted.
The hearings are September the 4th and 6th. I don't remember which one is which, but they told us in the notice that, when it's gonna go before the respective councils on the 4th and the 6th.
The 8th, I believe, is the,
Oh. Yes, you're correct, Steve. Thank you.
so, I mean, I'll try if I can, but we don't have an opinion either way, as you're saying, is what we're gonna go with.
Yeah.
I mean, we have an opinion, we're just not gonna voice anything to them, okay?
Right. Okay, now we're gonna move on to setting a date for the September tax rate meeting for us, correct? And this is all set by the state, correct?
Sorry. Correct, because our September board meeting is on the 30th, and I'm concerned that if there's not a quorum on the 30th, I'm not able to get everything over to the county clerk in time. So I'd like to set it for the week of
17th?
September 15th through the 19th, the meeting.
17th?
Are you trying?
So what time are you looking to set it for?
Anytime that week.
Oh, anytime that week.
The conference room will already be set up. The conference room will already be set up, and we have to have room for public to come in
would, yeah,
for
it
that
would.
meeting, so that day really won't work.
Let's see, I don't care. I'll make adjustments. It's what everybody else could do. Does anybody have a date they would prefer?
Because I also have to post the notice for 7 days.
I know that. I'm just saying,
Can
we
we
need to,
just, can we do it on the 18th?
I'll be out of town that week.
well, we need 3 for sure.
I'll be out of town the week before.
I'm okay on the 18th. I'm okay. Depends what time, but I'm assuming 4 o'clock.
That would be good.
You know what, I can't. do
I'm
it the
okay with
18th.
any of those 3 days, so.
We need a quorum on that day, so,
Need 3.
Yeah.
Yes.
I'll
So
be
we can't do it
available.
the 17th. I can't do it the 18th. Can we do it the 16th? Is that okay?
I'm good.
I'm open
Tuesdays are usually open for me.
on the 16th.
4 o'clock?
Mm-hmm.
Yes.
Tuesday, the 16th,
4 p.m.
4 p.m. Let me put that in my thing right now. I know, Jettie, you'll send out the proper invites for everybody,
Yes, I will.
because I will forget twice.
Thank you.
Sorry, I'm doing 3 things at the same time. All right, let's see. So We're done with that. Okay, the next thing on the agenda would be entertaining topics for the next agenda. Limit to 3 topics. Need a second to place on the agenda. Does anybody have anything they'd like to discuss?
I do.
Yes, ma'am?
2 things. When, we're having the medical director come, you know, it's been brought up about the contract and payment, stuff like that. Can we discuss what, you know, look at that after he comes and speaks with us? What we intend to do as a board to make sure that we're covered with a contract, the compensation, what that looks like. I don't know if like our personnel team needs to go out and, you know, get some numbers, what they're paying. I know we're not paying, and I'm still not understanding that, why he's not receiving any kind of financial benefit from being our medical director. But if we could look at other health departments and see like what kind of contracts they have and what kind of payment they're paying these medical directors.
Yeah, I'm going to tell you that that's probably the better thing to do right now is to step out and do that and go do research on what other health departments do. But I would keep that separate from the discussions that
Okay.
are having that.
Okay.
Just a greet and meet
Sure.
with him because I don't think he's going to be prepared for anything like discussion on that.
Do you want that discussion?
We'll have that,
September,
we'll have that
or-
probably, we probably need to have that as part of the personnel committee to talk about that if you want to, but I would do some quick research on that to see what other health departments do with that. I know there's a lot of health departments that pretty much are kind of do what we do. I know there are other health departments that, you know, spend a lot of money to hire other people, but I don't know where we're at in that. You and I have discussed that about, you know, should we not, do we need to do a contract? What do we need to do? I still think a contract would be a good idea, whether he's getting $1 or not.
Well, and it could be a contract or an MOU if he's not wanting to receive payment, and would just, I think an MOU at least
know.
would be something we
So-
need to do.
He is, correct me, but he is a Mercy doctor, correct?
Correct.
And I know that Mercy requires their doctors to do some of that giving back to the community. So it's.
And that'll be one of my questions
It's,
for him,
it's
if that's
part of,
where-
it is, I know it's part of that. They're kind of big on that. So, all right, so we'll look into that. So that's not that won't be next, I don't think you'll have that ready for next meeting.
And if not,
To
yeah,
have a
it's just that
discussion
we're
with that,
doing
you
it.
know, later,
Yeah.
but the personnel committee, I would try and drive it towards them,
Yeah, we can get together.
and get them in on that.
So you said that was going to be one of your questions to him?
Yes, as if he's fulfilling something with his current
Yeah,
employer,
we've seen that.
being our medical director.
Okay, because
for
I
free.
haven't received any questions from anybody yet,
Well,
so.
my email was broken
Okay.
this morning. Well, it was user error.
All right.
But I will get those to you.
Okay, all right, thank you.
So what are we looking as a drop dead date, so to speak, for questions for him,
Well,
the
I said
position? Pardon me?
today, I'd like to have them today, but, you know.
So but he's coming to the next meeting, right?
September, yeah.
So,
That's a
you know,
month,
if we
so.
could get them within, give you one more week to get those lined out, would that be good for everybody? Because I really don't want it to be cold turkey to him. I don't want to
No.
make it like it's a damn,
Well, I had 'em, and then I
Inquisition here,
couldn't
you
get
know,
on.
I-
I was messing, I'm
I
like,
know.
I don't have any email.
I mean, he does good work and he is
Right.
Busy.
very frugal, for us.
Yeah.
And I don't want to be an inquisition on him either.
My thought, when I talked to him, was that we would have the questions and present them to him prior, and that maybe when he comes, he can come and address the board, and
Yeah,
when
kind
he
of go through the
addresses, answer
questions.
those questions as part
Like
of his,
his involvement in COVID, like where he's, those are the kinds of things,
okay.
you know.
Yeah, I mean, we just need to
It
have
may
that
not
ahead
be
of
much.
time.
None of that affects the role of the medical director.
What do you mean?
That's not what they do.
You don't think the medical director should have been involved at all in how we proceeded with COVID restrictions or anything? And
No.
vaccines and all that, since he's on those orders? I do.
He can't do anything about that.
That wasn't part of the discussion on his end, for sure. All right, is there anything else we want to talk about as far as other topics? Anybody have any other topics?
I do have another one.
Okay?
A couple meetings ago, when I guess I was confused on like who we answer to. We answer to the Missouri, to the state level, and then the state level answers to the CDC, and then the CDC answers to the federal level. Am I correct?
They are the federal.
Is that
Yeah.
correct?
Yes, they are the federal. Mhm.
Do we have something in writing? Is it in a resolution? Is it somewhere that that's what we have to do? Are we bind to the state? Is it in a resolution, an article, or in our bylaws? Like, where is that?
So Christie, help me out with this. I believe it is all in state statute, correct?
It's in the state regulations.
Okay. Over the past 24 hours or 48 hours, there's been a big shakeup at the CDC. Several people have resigned, and the director has been fired. And I think some is non-compliance with the new COVID recommendations of who's getting vaccinated. That's my guess. As of before I got here, it wasn't officially out. Can we have a discussion on the board, like what happens if the CDC is no longer? Then how do we do that, or does the state change the regulations? Like, how does that all proceed if something happens to the CDC? If they're not doing their job and people are getting fired or whatever, like how does that work?
Pure speculation.
Well, and as my mother would say, we shouldn't borrow trouble, because we don't know what's going on, what's going to happen. God rest her soul. So I guess my first thought is that, so we go up through us to the state, to the feds. If something's happening up there, whatever drifts down from what they're saying to do, we're obligated to follow that. It's just how the statute's written. We don't step outside those waters, not supposed to. Some people do.
And the Missouri statute, the answers to the CDC?
We
that's
answer to the
written
State Department of Health, and they answer all the way up through the CDC. And that
Stidham.
is
The CDC's not following their people, what
Well,
they're supposed to do.
that's not,
Okay.
we can't, again, that's a fight that I think is being taken care of right now. From everything I've been seeing, I know that, the director was fighting getting fired, but I think it's a moot point. They say that she couldn't be fired by the secretary. Again, that's up at that level. I hate to say it, but what happens up at that level, yes, it does affect us down here, but we don't have those same issues that they have up there. That's a whole different,
Right. Well, I'm
ball
just
of
saying the
wax. I
people
was
we
gonna say
follow
something else.
Follow people that aren't doing their job,
right.
so.
Well, if something comes down from the CDC and there's a change, like I told you before, we change with it.
Okay.
We've done it all the time. I mean, they've made changes back and forth. We
Well,
don't,
but Missouri has to say we do it, not the CDC, correct?
the CDC comes down, they will give the,
Direct.
correct me if I'm wrong, but they're
CDC gives guidance.
and they
In the
come down.
states.
Not-
And the
We
state's guidance.
follow state code of regulations. We're mandated by that. And a lot of what we follow is the guidance of what the CDC.
Right.
They're the experts of that, and they've put out here's the best vaccine that you should be using, this is how you should use it. Those are all, and the states look at those and take those, and we follow what the CDC puts out as well. But most of what the health department does is state regulation, state code regulations. So to say if we don't follow CDC, it's guidance, but we have elected that that's what we're gonna follow, because that's where the best science is that we feel that we need to be following. And that's what the state health department follows as well. So if they go away, if the CDC goes away, or something happens there, I mean, we would probably continue following the state, I would imagine what they would do.
Let's bring this back around. If we're gonna have this discussion, we need to really get it on the agenda to have a discussion. But I don't know if we wanna, so my question is, do we wanna step out when we don't know if anything's happening? You know what I'm saying? I guess we can put a thing on there for current events if we want to sit there and have a discussion. If we think, if we're that much of a concern, that we can do
Things are
something.
changing so
But
rapidly.
I mean, again, all that's gonna come through them.
Okay.
If I'm not mistaken, lately, within the week, I think the FDA has put out guidelines for immunizations and vaccinations. Because I know schools have to have some Bidens. You know, we're getting
Yeah.
kids to school, and, you
Well, the
know, that has changed.
Yeah, FDA has come out with the type of vaccine, you know, the approval of it, or how you
So-
can use it.
I'm going to go ahead and ask, unless there's anything that we have a discussion next meeting on CDC, FDA, whatever updates, if there are any, let's talk about updates if there's anything coming out from them. Just a very quick discussion on that, and try not to get too labored into all their issues up there, because it is a mess, and I do understand that.
Okay. Thank you.
All right. Not hearing anything else, let's go into the closed session. Unfortunately, we're going to have to do this, and we will not be coming back out to make any announcements, so you don't have to wait for us. So we're going to need a motion to go into closed session pursuant to 610.021, privileged and confidential communication between the Board of Trustees and the Department of Health, its representatives, and its attorneys, and records which are protected from disclosure by law. It's legal. Do I have a first?
I'll make a motion to go into closed session.
Do I have a second?
Second.
Is there any discussion on the matter? Not hearing any, roll call, please.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Okay, we're now going to go into closed session, and thank you, folks.